You can throw your splash screen up for me. Hello, everyone. Welcome. We'll get started here in just a minute. Okay, it is the top of the hour. Hello and welcome all. My name is Alan Barr with COEH Northern California. And on behalf of the NIAR-supported education and research centers throughout the country, we're pleased to present the 2023 ERC Ergonomics webinar series, where we offer free monthly webinars on various topics on human factors and ergonomics. This collaborative effort on behalf of each ERC's continuing education program aspires to provide access to current research supported through NIOSH ERC programs. Thank you for joining us today. If you logged in with your registration email, you will receive a link to an evaluation form that will qualify you for a certificate of completion worth 1 continuing education contact hour. Coming up on the 29th, next week, in fact, the California Artificial Stone and Silicosis Project. You can register for that and other upcoming webinars at coeh.berkeley.edu/webinars. For today's webinar, we will be muted during the presentation. If you'd like to ask a question, please enter it into the online Q&A, and we'll save some time at the end to address your questions. The webinar is being recorded and will be made available along with other past webinars on the COEH Northern California YouTube channel. Please take a moment to like and subscribe to that channel to help us continue to grow. Today's webinar is titled Assessing the Relationship Between Job Tasks and Musculoskeletal Pain in Firefighters and Law Enforcement Officers. And it is being presented by Dr. Matthew Thiese. Dr. Thiese's research focuses on the overlap between a person's job and their health. This includes everything from musculoskeletal disorders like low back pain or carpal tunnel syndrome, to motor vehicle crashes, to COVID-19, to mental well-being. He's interested in identification of potential risk factors, interventions to prevent injury or illness, evidence-based practice for both treatment and prevention, and assessments of worker health and safety, fitness for duty. His graduate degrees are in public health, specifically occupational epidemiology and injury prevention. He has co-authored 140 articles, 31 as first author, 34 practice guidelines, 5 book chapters. He is also a tenured associate professor at the Rocky Mountain Cetner for Occupational and Environmental Health. Dr. Thiese has extensive experience in designing and conducting epidemiologic and interventional research. He's worked with first responders, healthcare providers, manufacturing, construction, and transportation workers, and has been part of multiple large prospective cohort studies evaluating relationships between musculoskeletal disorders and both job and personal factors. And with that, it's my pleasure to hand the microphone over to Dr. Thiese.
Awesome.
Welcome.
Thank you very much, Alan. I appreciate that very, very much. So this presentation is actually research that was done by one of my PhD students, Uchenna Ogbanaya. He is wanted to look at, really comprehensively look at firefighters and law enforcement officers' job tasks and how they relate to injuries and other health challenges. So moving into this, firefighters and police officers in particular, right, fall under the umbrella of first responders, but they are two distinct populations. Then beyond that, right, we can talk about EMTs and others. But particularly during the pandemic, as well as before, there were real challenges to the physical and mental health of firefighters and police officers. And those were all exacerbated by the increasing demands and challenges that both of those populations faced during the pandemic. So what we wanted to do was to do an assessment working with firefighters and police officers to say, what are the challenges, where do we want to go, and what are some of the potential ways that we could identify easily the challenging aspects of their jobs so that we can help design interventions and help make things better. So briefly, let's talk about just firefighters and law enforcement officers. They're a big population, 2.1 million firefighters and law enforcement officers all across the United States. So, and that includes, right, law enforcement officers are not just traditional police officers that you think of, but bailiffs, officers that work in, the prison system. There's many areas there. And then firefighters, there's wildland firefighters, there's city firefighters, some are volunteer, some are professional, and lots of just different, both populations are very diverse, but they both play a very key role in our society and our function of everything that we're going to do. So if you think about the challenges that firefighters and police officers face, there's actually quite a few similarities, right? They're both interacting with the public on a very regular basis in high stress situations, albeit differently, typically. So there's opportunities and issues with violence from people they're working with. They have, communicable disease exposures through bloodborne pathogens and other things. There's physical hazards because they're doing, lots of manual jobs, whether that's lifting, knocking down doors, chasing people, right? There's a whole bunch of things there. And then they really see parts of our society when they're at their worst, and that can have an impact through vicarious trauma or secondary trauma, right? Just to name a few things. So past publications have found that both firefighters and police officers, law enforcement officers, have high injury rates, primarily, and we'll get into those here in a little bit, those are physical injuries, so musculoskeletal issues, but then there's also challenges with the mental health, particularly looking at depression and anxiety, and PTSD are the three big ones. So what we wanted to do in our research was to look at, okay, how do job tasks relate to those two things? What are similarities, and then what are differences between those? So talking specifically about firefighters, in 2021, which is the most recent data, there were 60,450 injuries and 135 fatalities among firefighters. Most of those occurred primarily in the fire ground, so that's when they're out battling fires. But that was still not more than half. That was just under a third. Non-fire emergency incidents, but also training, getting to and from the incidents, and then other non-duty activities, right? The common thing about most of those injuries is that they were, more than half of them were musculoskeletal. All different parts of the body. There wasn't one particular body area that was a challenge. So musculoskeletal primarily focused there. You can see that injury rates, these are BLS data from 1981 when it was 103,000, have dropped down. So there've been meaningful improvements in injury rates to firefighters. They're actually in the 2020 timeframe, there was a little blip, but has traditionally gone down and is continuing to do that. Talking about law enforcement officers, there were higher numbers of injuries, lower numbers of fatalities. Similarities there, again, we're looking at musculoskeletal, primarily low back, but also some knee issues, shoulder, and elbow. And in the law enforcement realm, they primarily looked at those as related to an assault or a non-assault. Most of the statistics out there are looking, just differentiate those as the two types of activities and don't get into a lot of additional information about, is it when they're working on training or other types of things. In terms of looking at the locations and issues here, you can also see that, police officers versus all occupations, much higher rates of all sorts of different injuries, with the lion's share of those, again, being strains, sprains, tears, bruises, contusions, multiple traumatic, falling under the musculoskeletal, but that definitely is not exclusive for law enforcement officers. So that's a little bit of a background where we're coming from in terms of why this is important to us. So large population, high incidence of injuries and key to the function of our society, an important functioning piece of our workforce. So we wanted to address this looking at, okay, is there an easy way to go out and identify what are some of these issues, right? And so we focused on this concept of what is occupational stress, and stress, not in the psychological sense, but stress is in a challenge to the entire system of the individual, right? So what is that stress, and then what is their individual response? So sources of stress could be excessive workloads, like we saw during the pandemic, role ambiguity, individuals are being asked to do more than what they may have been trained to do or traditionally have been responsible for, lack of control and the types of calls that they're going on, where they're going on, and even when they get there, challenges in control there, interpersonal conflicts, again, primarily working with society when society is not at its best. But those interpersonal conflicts also can relate to within the organization as well. When you think about it, firefighters and police officers are very much a organization where everyone is pulling in the same direction. And oftentimes you have to, because you have to be able to trust the person working next to you with your life and vice versa. So most of those interpersonal conflicts are not inter-organizational, but when they are, there can be some real challenges there. Work-life balance. This really gets into challenges where there's, they're working 4 10s or they're working, 48 hours straight. And then picking up shifts because people are sick or injured or out, right? So there's real challenges to work-life balance with these populations. Organizational culture. There's documented research looking at stigma and how stigma plays a detrimental role on preventing and treating injuries in the workplace among both firefighters and law enforcement officers. Physical factors, I mentioned those a little bit earlier, and then the psychological factors as well. So looking at this through the paradigm and the lens of occupational stress, we wanted to look at 3 specific domains of health outcomes, and I'll get into these in more detail, but we wanted to look at traditional musculoskeletal disorders. So this is low back pain, shoulder pain, knee pain, and elbow pain are the 4 areas. We also wanted to look into psychosocial well-being outcomes. This is your depression, anxiety, PTSD, but then also sleep quality and sleep disturbances. And then we also wanted to look at metabolic health outcomes. So these are sort of what you would consider more traditional chronic health outcomes or chronic health conditions like high blood pressure, diabetes, obesity, metabolic syndrome. Our model that we're looking at this is using the job demands resources model. So conceptually, there's job demands, which are stressors, and in this case, all of these different stressors we talked about, we're going to identify those in job tasks. And we wanted to look and see, is there a relationship between these job demands and outcomes, health outcomes negatively, right? So as you have increases job demands, you would have worse health outcomes. And then under the JDR model, job demands resources. The resources part is actually the things that individuals have for resources to combat these job demands and mitigate the negative influence that they have on health outcomes, right? So you could think of job demands where, long work hours could be a demand, and the job resource could be flexibility in when you work, as an example, or the ability to call in sick and have people cover your shift, right? For an individual, that could be a resource. For an organization, that could be a job demand. So we're going to be looking at the JDR model conceptually. For this study, we did not quantify any of the job resources. We're just particularly looking at job demands and the different ways that you can measure both the job physical tasks as well as the occupational hazards and from a psychosocial perspective and the impacts that those have on health outcomes. So identifying the job tasks. We started off actually by conducting a series of focus groups. We had 9 focus groups among firefighters and 2 focus groups among law enforcement officers with a total of 96 people. We sat down, asked them information and said, okay, what are the most challenging things about your job? What are the physically most demanding things and what are the mentally most demanding things? Tell me more about those, really dug into the specifics of those so that we could identify conceptually what are the most physically and mentally demanding tasks. And then we wanted to quantify those looking at in the larger study where we said, okay, what's the frequency of these tasks? What's the intensity of these tasks? And then where do you rank these tasks in terms of difficulty? Again, our goal was to be able to more easily identify and point to the job demands for these two populations and see if there's a relationship with health outcomes. So that way we can go back and quickly identify job demands and be able to have an influence on those. So in terms of the job tasks that were identified through these focus groups, we classified them here, and you can see in the reddish tint will be our firefighters. So the job physical tasks were the most difficult was fitness testing or keeping up with fitness. Second was carrying equipment. Third was patient lifting. And fourth was actually doing a fire attack, knocking down doors, breaching roofs, that type of thing. In terms of occupational hazards, they rated the most challenging thing, or one of the top four were difficult or traumatic calls, losing a patient, the loss of life of a patient on a call, losing a crew member or another firefighter on a call, and then family or public at the emergency call. So interacting with those individuals there. We were pleasantly surprised, but somewhat surprised at the similarities between these for firefighters and law enforcement officers. So law enforcement officers, again, physical fitness, carrying equipment, working in a squad car while in full gear was another one, and then having a physical altercation or a foot attack. So foot pursuit, which was similar to the fire attack in terms of job tasks that they trained for. The mental occupational hazards were difficult or traumatic calls, losing life of a child on a call in particular, losing life of a crew member, and then extreme hypervigilance, that ability to always be on top of your surroundings and vigilant with what's going on. So, and I'll come back to these, you don't have to remember these, but these were the tasks that we then assessed using using questionnaire, and then to see if there's relationships with their health outcomes. So in terms of health outcomes, we had a psychosocial well-being, which we collected lots of different ones of these. Our primary hypotheses there were driven looking at depression, anxiety, and our sleep disturbances and burnout. We also had our 4 areas of musculoskeletal disorders, and then these 6 domains of metabolic health. So primarily focusing on cardiovascular health with these. So scope-wise, again, looking to say, okay, are there particular job tasks that are related to these health outcomes? And how can we quantify these job tasks to specifically differentiate the relationship with these negative health outcomes that we're looking at? So specific aims of this study were, first, look at these relationships between the physical task and musculoskeletal disorders. Again, we had those 4 musculoskeletal disorders. We had a specific relationship that we were looking at. Our hypothesis was that the tasks that were ranked as the most difficult job tasks, not necessarily the ones that occurred most frequently or were the most intense, but the most difficult job tasks would be associated with low back pain. Second aspect, which I'll be touching on, although is not the primary focus of this, is looking at the relationship between the occupational hazards and our health outcomes, our mental health outcomes of sleep disturbance, anxiety, depression, and burnout. And then lastly, we also wanted to say, okay, firefighters and law enforcement officers are often, like I said, classified under the umbrella of first responders. Is that appropriate to handle them in the same way, or are there differences there? So we wanted to investigate and see, are there differences between firefighters and law enforcement officers in these health outcomes? to be able to theoretically target interventions more specifically for these groups. Our hypotheses there were that firefighters were more prone to musculoskeletal disorders because of their job physical demands, and law enforcement officers have increased likelihood of having psychosocial demands because of the challenges with their job. So population-wise, we went out and administered a questionnaire and collected a lot of information. I'll get into the specifics there, but I wanted to talk about the populations here briefly. I'm not going to be coming back to these slides necessarily, but this is where we're starting for our population demographic. So we had 214 firefighters, 167 law enforcement officers. BMI and age were actually very similar for the two. There were more female police officers than there were female firefighters. In terms of breakdown, self-identified as urban, suburban, and rural, those were very similar. Racial breakdowns were also relatively similar, and ethnicity. So aside from the gender differences, demographically, firefighters and law enforcement officers in our study were very, very similar. These data were collected just recently, November to December of 2022, just over a year ago. Excuse me. Participants were recruited by email. We emailed multiple fire agencies and law enforcement agencies and explained the purpose of the study and provided a web link and QR codes and asked them to distribute this to their workers. And it was self-selection participation in this. It was a brief online questionnaire, IRB approved. So we had confidentiality, and we were sure to stress that. Excuse me. And this is just a cross-sectional study assessment. So questionnaire, we had a demographic information, which I touched on, psychosocial well-being. So wherever possible, we used batteries, validated assessment tools for the psychosocial well-being. So for example, for depression, we use the Patient Health Questionnaire 9, which is a 9-question tool that has high sensitivity and specificity for relationship with the diagnosis of major depressive disorder. We also asked questions about musculoskeletal disorders. So this was in the past year, have you had pain in any of these areas, or have you sought treatment in any of these areas? Low back pain, low back area, knee, shoulder, and elbow. We also had our metabolic health outcomes, which is, have you ever been diagnosed with any of these? And then really dug into the job tasks by asking them frequency on a Likert scale of never to often for each of those 4 job physical tasks, as well as the 4 occupational hazards, which are the psychological aspects. So frequency of those, intensity of those on a scale of 1 to 10, where 10 was the most intense, and then also looking at a ranking. So of those 4 job tasks, what's the worst, what's the second worst, third, and so on and so forth, right? So ranking of difficulty of each of those job tasks. We also had an other category where people could fill in if there was another task that was not identified there that they felt was difficult, and then we asked frequency and intensity of those as well. So statistical methods, we followed standard practices, mean standard deviations. We looked at normality, and if things were not normal, we would use non-parametric equivalents for those. I'm going to be presenting, like you've already seen, counts and frequencies. We also used logistic regression analysis. Our outcomes are binary, so it was yes or no for our musculoskeletal disorders, as well as a yes or no for our diagnosis or our depressive symptoms, anxiety, and everything from there. We also had some exploratory analyses, which we wanted to, based on our hypothesis, we thought that there may be some combinations of frequency and intensity, right? So if you think back, the main question we were looking at is the ranking as the most difficult task related to their musculoskeletal pain, right? So if police officers ranked sitting in a squad car in full gear as their most difficult physical task, did that relate to low back pain, right? We also, because we were collecting this information about frequency and intensity, we wanted to see if there's a better way of measuring those in a self-reported manner, of collecting data in a self-reported manner that would find a stronger relationship or find a relationship with these musculoskeletal disorders. Again, to be able to identify in the future if there are subsets of populations or things that we can have an influence on to improve the health and well-being of firefighters and law enforcement officers. So we did some exploratory analyses there, which utilized data-driven modeling to figure out, okay, we looked at 6 specific combinations of frequency and intensity, both of individual tasks and also summing those up to see if there's relationships, if there were better relationships than just what we had hypothesized of what is the ranking of the most difficult task. So we also looked, because we were using regression, we're able to control for potential confounders, which is always a good thing to consider. Confounders that we controlled for in all of the models were age, gender, body mass index, and then we had this list of potential confounders that we wanted to address and see model specific. Is there something, are these factors influencing or doing something on this potential relationship between their job physical tasks and their musculoskeletal outcomes? So long list here, lots of things that we considered. Many of them were relatively rare, so we did not have statistical power to address all of those necessarily, but we wanted to collect data on them because they were either identified as potential issues among our focus groups, or the literature has them, or just biologically plausible. So here's an overarching sort of framework for where we're going with this job demands resources model. So our job stress, our occupational stress with job tasks, we're looking specifically at physical job tasks and our occupational hazards, and then how those relate to our specific health outcomes. So again, aim 1, understand relationship between physical job tasks and musculoskeletal disorders among firefighters and law enforcement officers, thinking that most difficult job tasks, that job task that firefighters and law enforcement officers rated as the most physically difficult, would be associated with low back pain, which traditionally was the most common musculoskeletal disorder. So focusing in on that, these are the job tasks. So both firefighters and law enforcement officers identified fitness testing and carrying equipment or uniform as similarities. In firefighters, they had also identified patient lifting and fire attack, versus law enforcement officers looked at working in a squad car in full gear and physical altercation or foot pursuit. And then we also looked, again, we explored all of these musculoskeletal outcomes, but really our main hypothesis was looking at low back pain. Let me talk a little bit briefly about our exploratory analyses. So we looked at, again, the most difficult, which was our hypothesis. We explored to see if just simply the rating of frequency of each of these tasks by itself was related to it, or the intensity were related to low back pain in particular, but musculoskeletal disorders more broadly. We also looked at combinations of frequency and intensity. So looking at frequency of all of the job tasks combined, or frequency and intensity of all of the job tasks combined. In terms of the results for firefighters, again, that's why these are in red. The fitness was keeping up with fitness or fitness testing was the job task that firefighters deemed as the most physically demanding. It wasn't fire attack, it wasn't patient transfers. The fitness aspect were the things that was the one job task that was consistently rated as the most challenging related to their job. In terms of that, just as a ranking, if they participated in that, there was no relationship with low back pain. However, the fitness was related to specifically frequency of doing their fitness testing or keeping up with fitness was related to shoulder pain at 2.78 times. So those who had higher frequencies of fitness testing or keeping up with fitness related were more likely to also report shoulder pain. And the intensity aspect, when you build that in, it minimizes that a little bit. So they may do it more often, but not think it's as difficult. It's still statistically related to shoulder pain. Similarly, but less so. Similarly, the fitness aspect, how often they do that, was also related to knee pain. So firefighters getting out, keeping up with fitness, and those who said that that was the most difficult were more likely to have shoulder pain and more likely to have knee pain. In terms of their most difficult task, squad car in full gear, that was not statistically significantly related to low back pain as a ranking of difficulty, but when you count the frequency, so how often law enforcement officers reported working in a squad car in full gear, that was statistically significantly related to low back pain at a slightly elevated odds ratio. And these are all after adjusting for potential confounders. Confounders on these, we can get to that afterwards if there's a question, but adjusting for age, gender, body mass index, and then some of these other factors that were statistically changed the relationship by at least 10% was what we needed to be included in our list of potential confounders to be adjusted for. So I also want to briefly talk about the mental aspects of this. I think it would be remiss if we did not talk about the relationships between these occupational hazards, these mentally challenging aspects, and the psychosocial outcomes. Again, we were thinking the most difficult occupational hazard would be related to higher incidence, higher prevalence of sleep disturbance, anxiety, depression, and burnout. So going back to these, again, our list of potentials: difficult or traumatic calls, losing life of a patient on a call, losing life of a crew member on the call, and then firefighters said dealing with the public, and law enforcement officers said the extreme hypervigilance. Same types of things, only on this, we wanted to explore the relationship of doubling the frequency and intensity or doubling the intensity and frequency. So we changed these assessments a little bit, primarily because the ranking of the data that we had, we looked and said, okay, if you go back, difficult or dramatic or traumatic calls were actually relatively rare. Losing life of a patient or a crew member was extremely rare, but also rated as very intense, right? So we wanted to sort of highlight, is there a stronger relationship with the intensity part, or a stronger relationship with the frequency part of those? And then dealing with family or public or the extreme hypervigilance were a more common aspect. So relationships here, there were more relationships that we found with these outcomes. However, there was the odds ratios are a little bit are lower, right? So several things that were statistically significant, both on a sort of per unit increase as well as a block of 10% increase, right? Because when we're looking at frequency and intensity, it really opens up that range. So it's not just a binary or even a 1 to 5 ranking, but it really has a much broader relationship there. So these were related to having one of these health outcomes, these mental health outcomes. So difficult or traumatic calls were probably the most strongly related, with the frequency being weighted higher than the intensity aspect. Losing patient on a call, similarly, the frequency was more higher rated than the intensity, but combining them was better than looking at the individual of those alone. And then also looking at relationships between these aspects and depression, anxiety, sleep disorders, and burnout. Among police officers, relationships were actually relatively similar, although slightly less robust if you look at the odds ratios. So difficult or traumatic calls were the most meaningful, followed by the extreme hypervigilance. And then looking at all of these combined, both in terms of frequency and intensity combinations, all 4 job tasks combined were statistically significantly related to these mental health outcomes. And that was not just solely driven by difficult or traumatic calls or the hypervigilance. So our last one was to look at this and say, okay, are firefighters and law enforcement officers similar, or are they statistically different when it comes to physical musculoskeletal disorders and well-being issues, as well as these few select metabolic outcomes that we looked at, right? So really looking to say, are there differences between firefighters and law enforcement officers for these? So looking at it, law enforcement officers, our hypothesis was actually that firefighters would have a higher prevalence of low back pain. It was just the opposite. Law enforcement officers were 1.78 times more likely to have low back pain than firefighters, again, after controlling for confounders. This was a little bit surprising. We looked at it, and in terms of pointing to the relationship there, it looks like the activity of sitting in a squad car in full gear may have a relationship there. That one still needs to be explored a little bit more. But law enforcement officers, at least in our data, were more likely to have low back pain than firefighters. Firefighters, on the other hand, were significantly more likely to report sleep disturbance than law enforcement officers, 2.3 times more likely to report sleep disturbance. We've dug into this a little bit to see, okay, what are there particular job occupational hazards or tasks that are related to that? And it doesn't really point to one thing in particular. So one of the aspects that we're considering is that there may be some uncontrolled factors related to this. So sleeping in the firehouse, having irregular sleep schedules to begin with, the change in blood pressure and vigilance and things when they hear that tone that there's a call that they need to go out on. Some of those things were not aspects that we captured as part of these data because they were not identified as an issue in our focus groups, but there may be some roles within those. So summary of findings, I'm not going to go through and read all of these, but there were some surprising differences, as well as some surprises that there were not some more statistically significant relationships that we saw. None of our original hypotheses were supported. And even in particular, the low back pain being more prevalent among law enforcement officers than firefighters went contradictory to what we were hypothesizing. So from our standpoint, this was a meaningful increase in the ability to look at specific job factors and reported frequency and intensity of those as they relate to these meaningful health outcomes. So this may be an opportunity to be able to assess either directly from the workers or from other means in terms of calls and that type of stuff, the frequency of these things to identify, okay, are there different particular locations, are there particular groups, or even, so geographically or temporally, are there different times of year where these issues may be more of a problem? And so we can design and implement interventions both for the mental health side, but also for the job physical factors, musculoskeletal side. So I think I went over this really just now, but really talking job tasks for occupational stress, getting into that quantification of the intensity and frequency really is important and illustrative of relationships as compared to just what is the most difficult. In terms of the occupational stress with the psychological aspects, frequency and intensity, again, are probably important, although there really needs to be more research done on those. So it may not be that just simple difficulty of the task may not be a good metric for quantifying occupational stress and therefore relationships with these health outcomes. But really frequency and intensity, and of those two, it probably is frequency is going to be the better metric for occupational stress for both job physical aspects as well as our psychological outcomes, psychosocial outcomes. So from an application side, it may be easier to capture frequency of these in an administrative manner or through some other metric instead of having to do surveys and assessments, and then be able to design interventions to say, okay, we're seeing an increase in the frequency of, you know, sitting in your squad car on patrol in full gear. Let's see if we can do things to help prevent low back pain among law enforcement officers, either by reducing that exposure or by implementing some interventions, whether that's using the job demands resource model and providing more resources to minimize that, or even really providing some preventive aspects and treatments for some of those. So future research, lots of great. To me, like any good researcher, this is a good starting point, and it brings up several more questions than answers. So really, there's one thing that we haven't done with these data is look at these relationships between the psychological and physical components together as a combined impact on both either psychosocial outcomes or the job physical outcomes of, you know, musculoskeletal disorders. Similarly, we did not look at any of the job resources, either what's being done individually or organizationally, that would help provide additional information for ways that we can address that from a research standpoint to try and implement long-lasting improvements in this area. In terms of strengths, cross-sectional study design, we were able to design and execute this at the tail end of the pandemic and get good participation rate. We did look and found associations between several of these issues. There are several limitations, right? Bias is several different sources of bias. Probably the biggest one is a self-selection bias. We were asking people to voluntarily participate. We were providing a small incentive in terms of entering into a raffle for some tickets or a TV. So we tried to get people to participate and mitigate some of that self-selection bias, but that likely was there. Excuse me. And then we also, I think probably one of the other large potential biases would be the healthy worker effect. Are we missing people who have dropped out of either being a firefighter or a police officer because of their health issues? And so we're not able to look at these relationships, right? I would love to have a study design where we can do a prospective cohort study and or, you know, some interventional study to see better delineate these relationships and come up with better aspects. And then the statistics, excuse me, because none of our hypotheses were identified, because we rejected all of our hypotheses, we wanted to explore some of these other relationships. We should have, we use data-driven models for those, and I think it would be beneficial in the future to go through and actually come up with some hypotheses to say what are relationships between intensity and frequency that we're going to specifically look at instead of using our data-driven statistical models to find out which of these 6 combinations were going to be the best. So again, conclusion, this is conclusions from Uche's dissertation that difficulty by itself is not going to be your North Star for identifying occupational stress related to musculoskeletal health outcomes or psychosocial health outcomes. And really, you need to look at our frequency and intensity, and particularly combinations of those to identify those. We would like to acknowledge all of the many fire departments that contributed to this, as well as law enforcement departments. These are all across the Wasatch Front here in Salt Lake City. So from, it's the largest part of the population of the entire state of Utah. Generalizability issue maybe something there, but there were some wonderful chiefs, captains, and firefighters and law enforcement officers that contributed their time so that we could try and answer some of these questions. So I have some specific data, but I also want to preserve some time for any questions that we may have.
Thank you, Matt. That was a fascinating presentation. A lot to unpack there for sure. We do have a couple of questions coming in, and I invite you all to submit your questions. We do have some time here. Let's see. Can you speak a little bit about the impact of shift? A guest speaker, attendee is asking if you think shift plays a factor. So time on, time off.
So I think it's a great question. So I sort of alluded to that a little bit with the sleep issues among differences between law enforcement and firefighters. So I think that in hindsight, right, that's always the case, it would have been good to capture shift, both in terms of when they work, but also how long they work, as well as picking up additional shifts. That was one thing going through and reporting these findings back to individual participating organizations. They said, well, we have had a lot of people who are picking up extra shifts because we've had people going out either because they've been sick with, COVID or something, or because they've had some mental health challenges and needed, personal days and that type of thing. So it would be, I would suspect that that shift would play a role specifically in the sleep, but also I do wonder if it will play a role in the musculoskeletal disorder issues, and would think that would be a good thing to include in the next study.
Thank you. What is your working definition of full gear for the law enforcement officers?
So that's a really good question. We left that open to interpretation. So looking at our list of law enforcement departments here, some of these are relatively small cities or towns in northern Utah, and some of them, like Unified Police and Salt Lake City Police, are the two main ones here. So some of them have body armor, some of them don't have body armor, some of them have cameras, some of them don't, many of them don't. The belt with the weapon was a standard, but in terms of beyond that, we left that open for interpretation for the individuals. So that definitely is an area that could be improved upon in the next round of research to try and quantify that and say, okay, what about sitting in a squad car in full gear is it? Is it, wearing your sidearm? Is it armor? Is it cameras? Is it other aspects? So that's a great question.
Thank you. Let's see. Next question. Do the fitness findings for law enforcement officers apply to those who are in the training stage of their career as well as at work?
I think you guys have great questions. I think that is a really good question. The researcher in me says, we don't know, right? These were law enforcement officers who were active duty, had been for some of them, 35, 40 years, relatively few, right? But we did not have anything newly hired law enforcement officers or people during in school, in cadet school. So That's a good question. We try to, address some of that with controlling for age and that type of thing, but I would suspect that you probably see lower prevalence among the younger population in training. But there is that question of the unaccustomed work aspect and if that would play a role or not. So I think that's a really good question. So that's the researcher side of me, is we don't have data to specifically address that. I would say, though, that there probably is some relationship in there. And I'm also wondering if some of the training aspects that they learn in the, how they carry their belt, when they put on gear, that type of stuff, how they transfer patients, how they interact. I know that some of that is changing, and I'm wondering if that could have a beneficial impact on some of these injuries that we're seeing in the future.
This one's a little bit longer. It says, to what extent are the stakeholders aware of the specific exposures leading to adverse health outcomes in law enforcement officers and firefighters? Would the law enforcement officers and firefighters be on the same page with administrators and other stakeholders about the easier and harder fixes for these exposures?
That is a really good question as well. So most of, I say all, I'm going to say most of the departments that we worked with really wanted to know what the findings were. They were genuinely interested in being able to help their firefighters and law enforcement officers be healthier, do their job better, for all sorts of reasons, right? So I would think that they, in large part, were on the same page in terms of what to do with these data and how to implement their findings. I think that is a little bit more challenging. Some of the things that we heard were, are there cost issues with some of these things? What can we, is it a redesign of gear? Is it a redesign of protocols and processes? And how would that impact the delivery of service, right? Because that's always in the forefront of all of these individuals. How can I do this better? Not necessarily better for me, but better for the people I serve. So I think at the top level, everyone was on the same page. They really wanted to know the answers. I think when it gets down to brass tacks of implementing these things, there's different challenges there with actually being able to action on some of these data. So discussions are ongoing. We're actually talking with several of these organizations about sort of next steps and what can be done both in the short term as well as the long term to be able to improve, mitigate some of these exposures and improve the health of their workers.
Thank you. There's a suggestion here that the average age in your study being 40 years old is somewhat limiting with respect to musculoskeletal disorders that are sort of tied to the aging workforce. And the recommendation to include a more diverse population with respect to age may provide better results, and is asking for your opinion or feedback on that point.
So I think so. I think it's a great point. We do have a lot. We know that it's been well demonstrated that there's a strong relationship with increasing age and having higher incidence of musculoskeletal disorders. Many of the firefighters, as well as law enforcement officers, are able to retire, at least here in Utah, with a pension after 20 years of service, right? So if you do the mathematics, when people are going in their mid-20s, many of them are able to retire retire from the service when they're in their mid-40s, early 50s, and then can go on to consulting or other types of things, right? So I would love to have a broader age range and really focus on both those older officers who are in the service, but also look at the retired, those who have left the service because they have hit the age where they can start drawing a pension, and see what else is going on. Anecdotally, we've had a panel of firefighters who are really talking about long-term mental health challenges and physical health challenges that they didn't have during their service, but they think are related to exposures that they had during their service, right? So the short answer is yes, I think it's a great point, and I would love to get more information there.
Thank you. Do you have any specific mitigation recommendations or solutions you can elaborate on? I was thinking something along the same lines with respect to low-hanging fruit identified, where one could be most impactful with an intervention of one form or another. Perhaps a custom seat design with different modes for full kit versus no kit, and things of that nature.
Yeah, so that's one thing. That's surprisingly not that much of a low-hanging fruit. So I agree, sitting time in their patrol car in full gear was related to it, right? So both the frequency and then the intensity, perceived intensity. So is there a way to modify those seats in one way, or the gear that they're wearing, so that there's less of an issue there? The other part is to have less time in their squad car, right? So there's some sort of potential job built environment things that can be done in that sense, as well as looking at, are there policy issues there where they spend less time in their vehicle for one reason or another, right? Even if it's standing outside of the vehicle, walking around. So there's aspects there for law enforcement. For firefighters, it's a little bit more challenging, right? So issues there, right? Continue training about proper manual patient transfers, challenges and how to handle dealing with the public. The training fitness aspect was something that was consistent among both of them. And that one is a little bit harder to crack, to identify, because each of these agencies have standards, but they're not necessarily assessed in the same way or are necessarily the same standard from department to department, right? So I think part of it would be a real look at, okay, are the fitness standards that are there sufficient? And then how is testing for those done? Could that be done in a less stressful type of manner, and or the training? How much of this is a prescribed training versus just saying, you need to be able to pass this test, go figure out how to do that, whether that's weights or running on a track, right? And how much, so is it directed versus how much of it is sort of self-directed and therefore more possible for injuries, particularly to the shoulder and the knee. Does that answer your question reasonably well?
Well, I will with trust that it has for now. We'll just move on. Thank you for that. Why did researchers, this is just a quick technical question, why you chose to use a Likert scale versus a Borg or visual analog scale?
So that's a great question. Part of it really came down to feedback that we got during the focus groups. They weren't really able to parse out, right? So say we had a visual analog scale of 0 to 100. People would just generally pick, 20, 25, 50, 75. There was not a lot there. The differentiation there and the ability to gain resolution and quality of data actually wouldn't have worked out that way, but we found it actually did add a lot of time because people started sitting there trying to add things up in their mind. So it was a conscientious decision that we made because this was volunteer, to try and minimize the time aspect, but still preserve a range of data instead of having a larger range where people would spend more and more time and our participation rate would drop.
Okay, just time for one more quick question. Was there a location in the study that would be considered a large or medium urban city?
Yeah, so many of these were Salt Lake City, and outlying areas. So Wasatch Front population is about 1.1 million. All of these were within that, and that's about a 40-mile range, right? So Salt Lake County, Salt Lake City are relatively they're the largest cities in Utah, right? They pale in comparison to, California cities, but Salt Lake City and surrounding areas in itself is reasonably large at 1.1 million individuals.
Okay, excellent. Thank you, sir. This is probably running out of time here. I'd say we better wrap this up. I want to thank you for your questions, participants. If I didn't get to your question, I apologize. Next time, I'll do better. You can learn more and register for our upcoming events at coeh.berkeley.edu. You can also subscribe to our YouTube channel, where you'll find recordings of previous webinars and other events. And as a reminder, if you logged in with your registration email today, you will receive a certificate of completion worth 1 continuing education contact hour. If you have any questions for us here at COEH Northern California, you can drop us a line at coehce@berkeley.edu. That's coehce@berkeley.edu. Another big thank you to Dr. Thiese for an excellent presentation. We really appreciate you taking the time for us today. And do you have any closing comments?
I'm happy to answer any questions. You can find me at matt.thiese@hsc.utah.edu, or look me up on the Rocky Mountain Center for Occupational and Environmental Health website.
You heard it right there. Thank you so much, Matt. Have a great day, everybody, and we'll see you at the next one.
Thank you.
Bye.